Thank you, Dr. Sanjay Singh, sir, and Sahani, sir. Good evening, good afternoon, and good morning. This is the 1517th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. NAJEEB Ahammed. Let us begin the session with 1 minute silent prayer. Thank you all. It was really a wonderful session in the Hindi session today, and we are really happy to have such sessions in the future also, so that homeopathy will be the beneficiary, because remembering such things in a group is something great, as far as it's really a complimentary thing that we can do a great tribute to our masters, whether it is whether he is from India or from other part of the world. It doesn't matter much. What matters is the kind of presentation. Congratulations to all the Hindi team here. And there is no meaning in strict control of the time, because we have what we are doing in all the sessions are promoting homeopathy by itself. Our guest is ready, and let us go to today's session. And as you all know, today we have a session from Dr. NAJEEB Ahammed. A doctor has already presented the first part of the subject some 3 days back, but it was really a brilliant session. So we want to have a continuous session to complete the session, as well as we can have a discussion time for the same, because it's really a worthwhile session. A holistic approach, as you know, the subject was a holistic approach to body composition and well-being. And today, a doctor will be discussing about the second part. And let me introduce once again, Dr. NAJEEB Ahammed has more than 15 years of clinical experience. He is practicing in Dubai now, and has completed BHMS, IFPM, FINEM, MBA, SCS, and he is a very good international speaker. So we proudly welcome our guest, Dr. NAJEEB, to this session.
Dhanesh, Dr. Sahani, and all the leaders, thank you once again. My fellow homeo doctors, I am thankful for inviting me once again to this auspicious platform, and I congratulate all behind this. So let me just jump into the session before it is too late. So we have give me a minute. Let me just open this. Share. Being. Today we are going to cover a few parts remaining. Importance of body composition, aging, chronologic, and yes, aging, chronologic, and metabolic, muscles, water, protein, and health, setting smart and realistic goals. These all, if we are serious about this, you can use all those tools, techniques, which I'm going to share today in our everyday clinical practice. So fat loss, muscle gain, recomposition, that is the third thing. These are the focus point where we need to focus when we work on your health and fitness, when we play with our body's weight management. So these are fat loss, muscle gain, recam, which area we need to focus on. Then again, we will look into factors affecting body composition, various tools and measurement devices, and the ways of tracking. We will be looking into that briefly, and impact of lifestyle in body composition. These are a few things we are going to look into today. And let me just take 2 minutes to do a quick recap of something we have discussed in the last meeting. We have gone through a story of Frankenstein, Dr. Frankenstein, in that we try to understand human beings are not assembly of spare parts, and we have revised something about balance is the most important, not being stronger and bigger. Because today also we are going to revisit some of the element of this aspect of presentation. Then we have discussed something about what is body composition all about, and we try to understand various parts of a body composition like muscle mass, essential fat, non-essential fat, bone, and other body sub elements of body compositions. Brick by brick, we try to understand that, and we try to learn more about various sub elements. Then we have looked into body mass index, and which talks about various ratio, talk about ratio of body weight and height, which is the most popular and most utilized way of uh, understanding the fitness journey. Still, in most part of the world, even our we clinicians, we limit our exploration in BMI, which is a very limited tool to understand the actual scope of our body's health. So we need to go beyond that. That was the message we tried to discuss in the previous session last week. So let us explore further into that. Beyond BMI, why body composition is important. So here, when we compare body composition and the classical BMI usually measure our body's weight and height, nothing beyond that. It won't give you anything about your body's water content, your body's mineral content, your body's fat, how much in muscle mass you have. You won't get any understanding about all these detailed versions of our body story when you go into a simple BMI thing, which is conventionally we do. And we cannot distinguish between fat and muscles, how much fat is there, how much muscle we have. So BMI can be highly fluctuated. When we take a good amount of water, this entire water or some heavy food we do, the entire thing can be changed simply by taking a liter of water so these are highly vulnerable for any ingestion of water or food. Then it focuses more on numbers in kilograms and no it in kilograms and weight and height in centimeters. It won't give you anything more than that. Again, coming to body, and again, BMI will not give you any understanding about fitness. It give you a broad numbers, use kind of some broad numbers. It won't give you anything about what is happening actually within your body. For that, you need to go dig deeper into that. For that, body composition is the best one of the best method. Measures proportions of fat and lean mass. These are the two major segments. Then it differentiates fat mass and lean mass in various metrics, and it is more stable and meaningful than BMI simply. So it focuses on quality than quantity. It provides insight into fitness, health, and it helps you to graduate, monitor, and track your fitness journey onward by using various tools. So why body composition is important? This question we have been trying to decode in the previous session also. The body composition will help you to understand the health risk. If you have excessive fat storage, whether your muscle mass is optimum or not, whether this muscle mass is going to help you metabolically to address all those chronic diseases. So that is one of the very important metrics, especially the muscle mass and the fat mass in bad area, vulnerable fat, non-essential fat. We will get all those pictures while doing the body composition. And this will help us to set realistic fitness goals and tracking. So again, it will help us to optimize our nutrition. It will help us in tailoring our personalized fitness programs and exercise programs. Again, it will help us in improving our self-esteem and self-image by realistic expectation, and by boosting our self-confidence. And most importantly, it will give us a biochemical profile and give us what metabolic age. We all know our age in terms of chronology, in terms of our calendar age. It is there in our passport, it is there in our records, but we are not aware, we don't have any clue what is our metabolic age? What is our functional age? Which is much more important as far as people who are going to pursue our health in, in details. So why it is important? Once we know the meaning of metabolic metabolic age, metabolic health, we will understand the importance. We know the major killers are booming like anything. Major killers are, these are the values which we can see the increment in last 5 years in most of the major killers. All these major killers, most of them are metabolically connected. If you know the metabolism, we can better understand the villain, the enemy, the playing and how much it is playing. When we are going to have our diabetes, if you know our metabolism better, we can graduate, we can understand what is our where we are traveling, where our patients are traveling, how near they are in their insulin resistance, and how near they are in their risk of contracting a pure a frank diabetes or hypertension or cardio metabolic disease disorders. So it'll give you a lot of understanding about obesity, why metabolism is important, why understanding metabolic measurement, body composition is a thing about everything about our metabolism. So 1 in 8 adults in the world is obese according to World Health Organization and most of the other major watchdogs. Again, when it comes to kids, it is much more dangerous. 1 in 3 kids are obese according to in most of the Western world, in most of the affluent society, even in our country. Obesity is a disease at any age, and in children it is increasing like anything. So when we talk about obesity and fat, what should be the fat content in typically in man? It varies. Again, BMI will not tell you anything about. BMI is common for male or female. There is no male female graduation in BMI. But when it comes to body composition, it is different from male and female. It is gender wise, age wise. There are a lot of metrics. It precisely talk about age category and sex category. And all values, let me just read out few of the important values in obesity or fat concentration, fat in your body, because we are all carrying the body fat as a luggage with us to our road, to our, to our onward journey toward flight called this is air. So we are all carrying luggage of body fat. So how much is too much? If it is below 14, anything under 14, if you are under 30 years old, anything under 14 is bad. Even if it is 50, 60, 70, whatever age it is, under 14 is critical and bad. You need to have at least 14% of a body weight of fat mass. Again, what is the best thing you can achieve? Anything between 14 and 16 is good for 30, and under 40 years it is about 18 is okay, not beyond that. And for somebody who is 50, it is 20, you can go up to 20% of body fat. And if it is 60, you are 60 years old, it is 23. And it is for 70, it is 24 percentage. All is in percentage. This is the best thing. You can go up to 24, you can go up to 20 if you are under 40, under 50. Coming to good, it is at least good. Okay. So at least we need to focus here. At least we need to achieve this. If at all we are not excellent. For anybody who is under 30 is 20, and under 40 it is 21, and 50 it is 28, 60, 70 it is 31. What is the poor thing in that? How much you can go? It is the case in most of our cases. Most of us are in this poor category, if at all we are not in a very bad shape called extreme high. Poor case, 30 years you can go to 27, and again if you are under 50 you can go to 32, under 70 you can go to 35, and that this is the next one, which is at least 30% of the population is extremely high in most of the affluent countries, where if you are under 30, it is 27, again 32 if you are under 40, 50, and it is 36, anything over 36 percentage of body fat. You can check it. You can check it in most of the, even same simple devices are there. We will go into that later. Few thousand rupees you can buy these devices, and this can be calculated. This can be measured in most of the gym places, in your wherever. If you are a gym goer, most of gym they have this body biocomposition scales. So that is for females. For men again, let us look into what is good. If you are under 30, 14 is good. Anything beyond that is not good. Okay. If you are under 50, it is 20. You can go up to 20 percentage of body weight. And if you are under 70, it is okay to have 22% of body fat. And what is dangerous? What is dangerous? If you are 23, if you check tomorrow and you see that your body, if you are under 30 and your body fat is 23, it is dangerous. It's totally dangerous. And if you are under 50 and you see that your body fat is 26, it can invite diseases. You must be already having a lot of problems in your body. And again, if you are under 70, many of us in the room, you are under 70, you can not go beyond 28, which is again anything over 28 is bad. So that is what we need to understand about. If it is for men should be lesser in body composition than female. Men cannot have female, it is 36, it should be 28 for somebody who is under 26. Men cannot enjoy that much fat in your body. So this body composition will give you a fair understanding about how our body is aging, something about biology of our aging. Biology of aging is something the new science is dwelling a lot into, and a lot of new understanding is coming in. And you need to understand what is the chronological age, what is the metabolic age. Okay, this is something different. We all are aware of chronological age. We ask about our patients, what is your age? It is recorded in our our case sheet, but we don't have any clue about metabolic age of our patients. We even do not know our metabolic age. So these are all calculatable. These are all the metrics are there to understand that. So Geeta, an example, and Mr. Sham, both lived to 95. Okay, both have reached 95 of age, but Geeta started to support on cane and having started to have all the age-related diseases when she is 60 or 55. But Sam could climb his, some mountains, some stairs, he can engage some, adventurous sports, even if when he was 70, and he can enjoy some functional mobility even when he was 80. So you will see that metabolically Sam was fit even he was 85 or somewhere near to 90. But Geeta started to have a lot of problems when she was 55. So both were enjoying a lifespan of 95. Their chronological age is 90. When they reached chronological age of 55, Sam was very healthy, very active, but Geeta was very much dependent on various things like medicines, like cane, like supports, and suffering from all those age-related. So metabolic age of Geeta was much lesser than Sam's metabolic age. This is how we can we have metrics. We can measure this metabolic age. What happens when we advance in numbers, in aging? So there are few changes in our body which is measurable. Changes in quality of organs which can cause a lot of diseases. Body in fat percentage will increase as you go older and older. Anybody, healthy or not healthy, it by default it will increase. For people who are unhealthy, their fat percentage will increase drastically. For somebody who is not that sick, who are healthy, their fat percentage will increase still, but in a slower pace. So if while you go advance in aging, you tend to go overweight naturally, but you can go obese and naturally if you do not mind it. Bone density again, the bone density depletion, fat is increasing, bone density is inversely going down. It depletes, it can cause a lot of joint pain, fractures, like senile fractures, and muscle thinning or sarcopenia. Osteopenia and sarcopenia is another common thing which we can see. In muscle thinning, what will happen? One of the direct effect of muscle thinning is metabolic disorders like sugar. Sugar is one of the reason is you have lesser quantity of muscle mass. Lesser the muscle mass, poorer the insulin metabolism and sugar metabolism. You can have cardiometabolic diseases like pressure, sugar, etc. While you are having muscle thinning. Again, dehydration is another thing. You will go wrinkle, you will go lusterless. Your skin, your hair will go rarer and thinner. So this is another thing. Denaturation of protein, another very critical thing, very important thing. Well, what happens when we grow older? Your protein's quality will go down. A lot of challenges in the protein's quality. Eventually, that will address it. That will affect your tissue metabolism, your genomic metabolism. That will eventually affect genomic expression. That will directly affect length of your telomere. Telomere is one critical thing which will which is a measurement, which is something we can see that it loses its length as we grow. So what will happen when the protein is denatured? You will have a lot of weakness, bad hormonal production. You will have cataract kind of thing, and you will have a lot of problems in your arteries and veins. So these are all connected to protein metabolism and functional elements of protein metabolism. Again, hormone lowering of most of the hormones, which is directly linked to many of the diseases. Telomere, I already mentioned about it. Telomere is shortening, age will go in full speed. Changes in functional capacities, all these changes which I have explained in the previously will eventually go into dependencies, a lot of functional disabilities. So we will depends on gain on our subordinates, our people around us, our family and friends. So this is something which is going to happen as we age in advance. So this aging is something we can play with. This is not mandatory to have all these at some particular age. We can play a lot in that if you know the science. Then again, factor affecting body compositions. Genetics, of course, genetics is a very important thing. Age and gender. Age is important, as we have seen that, and your sex is very important. Hormonal changes like cortisol, very important, hormone which is related to our activity, stress, our energy level, various other, if it is too much in the modern, cortisol is important, very helpful hormone, but unfortunately, we have a lot of cortisol. End up we are having a lot of bad hormones. Cortisol will suppress testosterone, and it will suppress estrogen. So all this hormonal axis, all this hormonal balance is toppled when we go further aging. And again, diet and nutrition can affect your body composition, your water level, your muscle mass, your fat mass. Everything is affected by diet as well. Sleep, stress, exercise, all these are the factors which can in various ways, these can, and various diseases and chronic condition as a vicious cycle affect our body composition. Body composition can cause diseases. Diseases again can further deteriorate your body composition as a vicious cycle. So we all talk about body composition. We are worried about something called weight loss. We are all worried about weight loss. It's a $1 billion industry. Weight loss, weight loss, weight loss. Is it a great thing that we focus on weight loss? We are doctors. We know we should know the science. Improving our body composition much important than simply cutting down your weight. Weight. Last session we have discussed about that. Drastic cutting down of weight is not at all a good business, not at all a good idea. So weight loss only reflects decrease in body weight. It is something we talk about BMI. Weight loss is something we talk about a unidimensional metrics. It won't give you a broader picture. It will give you a narrow picture, which will not help us in achieving any of our fitness goal at all. So weight loss, simply cutting down the weight, simply focusing on reducing your weight, eventually losing muscle mass in most cases, is often become disastrous. Body composition is the best method. It improves the improvements focus on various other factors like reducing the fat and improving the muscle mass, improving the quality of your water content in your body. It will improve. It will talk about. It will uh, you know uh, give an understanding about how the protein quality is improving, how the water retention is improving. Body composition give you all those metrics, all those guidelines, all those visibility, so that you can work on those parameters and do better on your health. So do everyone needs six pack? One of the other thing, coming about bringing down your weight to some kgs is not the big thing. Maybe bringing down weight is important for many of us, but it is not without any metrics. That is why. So bringing down, another thing, another misconception is that six packs is the ultimate, metrics, ultimate, yardstick for best health. It need not be. Somebody can have better health without six packs than somebody having six packs with a strong core muscles. Core muscle is important. You have a strong core muscle, still you may not be having. You have a strong abdominal muscle, well developed abdominal muscle, still you may not be having a defined, revealed six packs. So six packs is something different. Somebody can go into a dangerous shape only by venturing on a lot of work on six packs, by losing protein, by losing water, by losing food, no, bringing down your food. No, in many cases, people venture into eating less, drinking less, and go extreme, workout thing. Extreme workout will increase a lot of cortisols. A lot of cortisol is dangerous. So these are all something we need to bring into balance. I'm not against working out. I'm not against cutting down your food, but cutting down should be with the philosophy, with the visibility, with the plan, where what we need to cut down, what you need to increase, what should be your diet. It should not be something like, there is a, fashion for going behind extreme ketogenic food. Ketogenic food is a wonderful tool for bringing a lot of disease condition back to normal, but it is a medicine. It is a therapeutic device. It is not a thing that everybody can use. Extreme ketosis and cut down your body weight drastically, and ended up with a lot of diseases. So we have seen a lot of cases having ketogenic sarcopenia kind of thing in my clinical practice. So this is not a great idea to go extremes of any kind of course, you have a lot of disease condition. Reversing it, you can use ketogenic food. It's a wonderful tool. It's a best advice tool, but it's not a lifestyle. You should not go beyond some limit, overdoing ketogenic food. So the balance is the best thing, best philosophy, best method we can go for. Again, factors like genetics and percentage of fat and distribution of fat around your body. Again, is axial fat and essential fat. Okay, and appendicular fat can be a sign of pathology. So your muscles should be well robust in around your limbs and hands and feet, upper and lower limbs. So distribution of fat is important. Peritoneal fat is not a great idea. Subacute fat can be okay for some degree, but even it is around waistline, having a lot of subacute fat is not recommended. So again, health is a multi-dimensional thing. It is not simply revealing an abdomen. Okay, there are professions, there are athletes, there are movie stars, fashion industry, there are people who are models and movie stars. Maybe they might need to go for six packs. Okay, and people who are young who can go for a six pack, of course. But at 70, 80, venturing on six pack without knowing your body's chemistry often prove dangerous, unless these movie stars or athletes and elite athletes, they have a team who are monitoring them. They have a lot of resources for understanding where we are going to go beyond the red flag, where they are going to jump into dangers. So this is not the case for common people. So common people jumping into some extreme measures to go to six pack. I'm talking too much about six pack today is because this is something we have seen in a lot of dangers, ended up. But it is a good thing for youngsters. It is a good thing for, and if you have resources to monitor your health and you have a very good understanding about it, you can still go for six packs. Of course, you can play around with if you know the science. And again, excessive exercise should be optimum, nutrition and hydration should be optimum. That is the key. If that is optimum, you can play with your body, you can venture on some pack, if at all, if it is not six pack. You can really bring down your abdominal muscle mass, sorry, abdominal fat load, and you can scalp your body. Of course, I'm not against that. It's a good idea, but a good thing, but you need to know about it. So coming about goal, we are talking about six pack, we're talking about bringing down. You need to have a goal. You need to understand first. You need to have all those metrics. You need to work on your measurement of your water level. You need to understand what is your body fat, what is the current level of your muscle mass, all those metrics for protein content and lean muscle mass. Everything can be measured. So if you know all this, and you know your job, you know your biometabolic condition, you have a fair idea about what you can eat and you cannot eat. Everybody cannot eat ultra nutrition food. Availability can be a matter, economic reality can be there. So knowing all these things, you can have a realistic goal, you can set a realistic goal. So realistic goal is very important. For that, you need to understand few things like lifestyle is one thing, your occupation is very important. When you set your goal about fitness, sculpting your body, playing around your body, you need to consider your occupation also. Whether you are active, whether you are sedentary. So, and again, how much time you can spend on exercise, how much committed you are with your food, and again, your age is important. As you go older, your experiment can have some limit. And health status is another thing. You are having chronic diseases like diabetes and hypertension. It's not advisable to go for extremes of all those things. You need to be monitored by a healthcare professional and somebody who is recovering injury and kind of things. You need to again work on, you need to observe some caution again there. And again, so one other very important thing is psychology of body image and self-esteem. This is something which our youngsters or our new age people are encounter with. So we are all having a lot of negative image about, and from the child, from the very young age, we are all put by our society, by our friends, our elders, about a lot of negative image of our body shaming, bullying, as we have discussed in the last previous session, and a lot of negative images are there in the society, especially in our rural society. They have if you have if you go a fitter, and that is a common scenario. You go fitter, you lose some weight, and you define your body. You have a better body metrics. People who are elders who may worry about yourself because they want to see you plumpy and fatty and chubby. So plumpy, fatty, chubby kids, we over push. Most of the parents, young mothers, they are worried about the weight of their kids. They are not worried about the healthy metrics. They overfeed to make the child chubby and plumpy. So that is another negative body image, negative education we have about that. And good thing about positive image is that now we are about that, and we respect that we are now working on our body metrics, our body shape, and working on, many people are now investing their time and energy to reach into a better thing. Where we need to focus now, this is something which we need to understand. Should we bring the fat down? Most of the people's worry is bringing the fat down. Of course, bringing fat down is not a bad idea, but what is your age? What is your sex? How much you can go down? Okay, is it gaining the muscle, or you need to recompose? It is the midway between gain, fat loss, or muscle gain. Okay, you are 65. Okay, some people will think about, I need to go for 60, and they will bring down their muscle mass, their body water, their fat, everything down. They will play around and they will bring everything down. It's not a good idea to go leaner with your muscle mass, okay, and reach 60. If you are a stronger muscle mass, even 65 is better than 60 if you have a better, stronger muscle mass. So it is not that number in kg which is determining your health. It is not. It is how much muscle mass you have, how much functionally strong you are, how much water you have. More muscle mass you have, more water you have. More water you have, more metabolically strong you are. So that is what. So is it what is that? So where we need to focus? We need to when you think about fat loss, we need to play around with deficiting your calorie. Some people, it is, we need to work on your fat loss. There is nothing wrong in that. So calorie deficit. So you need to lesser than what you work on. How much daily calorie you need, how much physically you are you active. You need to bring your food a little lesser than in calorie wise than your activities. So that is one thing. So intermittent fasting is another thing. We can bring the fat down, and cardio, strength training, these are the few ways we can bring the fat down. It is not wrong, in some group it is good to go for, bring the fat down, especially in gents, if at all not in female. Healthy fat, again, muscle gain, another thing. If you are focusing on muscle gain metabolically, for middle age, most of the people, especially after 40 50, our focus should be gaining muscle. Our focus should be to maintain our muscle mass and prevent sarcopenia, a dangerous condition. So this is eventually where we are heading to. So diet calorie surplus can be something we need to go for. It is not calorie surplus. Cutting down carbohydrate, go more into fat. Maybe you will be adding more fat than carbohydrate. So working out properly, then progressive overload. Now, how you can build up your muscle? By doing something called progressive hold, resistance exercise, weight resistance exercise, and these are the workout we can go for and add on. And protein timing, rest and recovery is another thing. You will be working more to gain more muscle. So adequate recovery and rest is very important for people who are doing that. The third one is body recomposition. Body recomposition is another thing which can show dramatic, because you are working both. Body recomposition, you won't see much drastic result with body recomposition in advanced health and fitness people who are already fit. And but newbies, somebody who started their journey, they will see drastic result in body recomposition, so it is advisable for them. Another thing is body hydration. We have already reached 45. Maybe I will just finish this slide and we will go to discussion after this. Hydration and water balance is another very important thing. So as we go older, we tend to retain less body mass in terms of muscle, less body fluids. We tend to keep, although we bring a lot, our body cannot retain it because we do not have enough muscles to retain it. So and one of the commonest thing is dehydration, dryness. So we need to know it is a common thing. It is not it is not advisable for everybody. As a standard, as an optimal, we can have 2.7 liter for women and 2 to 3.7 liter for men in an ideal situation. But situation to situation, it can vary. Somebody who is sitting in, somebody who is working in outdoor, sweating a lot, the picture can be different. And another way you can look into is 1 liter for every 25 kg. This is another way. But somebody who is having some diseases like kidney failure, this may not be applicable, of course. And age related changes can be there. So these are all, there are factors which is, affecting our hydration. But this is something we can pick. So we can pick somewhere. And while during exercise, you need to do hydration before, during, and after workout, of course. And evening hours, it is not advisable to have a lot of water. Morning water boost is okay for us, but at any time, in 1 hour, you cannot go beyond 1 liter, because there can be something like overhydration. Overhydration, too much of water is disastrously dangerous in some cases. Water toxicity can develop, too much of water in a short period. So signs of hydration is fatigue, dehydration, and dry mouth, skin, headache, and a lot of, you all know about that. So dehydration is something we need to think about. Let me just give you some idea about various tools which we can use in measuring our body biocomposition. Something called BIA, or called bioelectric impedance thing, which is a very common thing which we can use in our house also. There are 2-3 varieties. One is commercial, which is expensive, but if you pay 6,000 8,000 Indian rupees, you can, not even 2,000 rupees, you will find good biometric devices out in Amazon and all. Like this is it's a bathroom scale kind of thing. You can use there is another thing called DEXA scan, which is a very sophisticated device, very expensive, and the test is also again, but the result is very accurate. Then skin fold caliper is a 200 rupees or 300 rupees device, a small clip-like thing which can measure your body, subcutaneous fat especially, and it is for tracking your progression, is a very good thing. Then hydrostatic weighing machine, it is a funny looking device which is often used in something called our research purposes than clinical purpose. Another one is air displacement plethysmography, or BOPOD, popularly known. It is mostly used. This again very expensive one. It is not a household device. In wellness centers, it is used in Dubai and Western world. We have seen this device used in wellness centers. So these are the few devices we can use. So as I said, BI is very quick and non-invasive, affordable. DEXA is very accurate, but it is very expensive. Skinfold calipers is very cheap in price, good for tracking, of course, but you need some skills. You need to know how to pick, how to take, how much, where you need to measure it. Again, it is learnable only. The other thing is hydrostatic weighing devices, accurate, but it is uncomfortable, time consuming, not advisable for clinical purpose, but it is being used in research. BOPOD is another thing which I have already mentioned. So thank you so much for listening to this, and we can have further discussion about this in another session if needed. But this itself will ignite your interest in the topic, and I request all of you to go further into learning of these things. Thank you so much for giving me this opportunity to present this topic. Thank you.
And Dr. Najeeb, it's really a different presentation. You really bring some of the most important facts about these body matters and everything, and how it can be improved, how what are the misconceptions thoughts in the minds of people about the weight and weight gain and weight loss, how it can be equalized and everything. Anyway, congratulations for such a wonderful session. All the slides were so much brilliant. So it shows how risky, how much of time you are consuming for making this seminar a successful one. I invite Dr. Manoj to begin the discussion.
Thank you, Dr. Tanish. As indicated by Mr. Tanish, is a really wonderful topic. And of course, it remains as of our aphorism for like as a preserver, things causing damage to the body. So that's a very important thing. Then I mentioned that another thing is that they are really discussing on also 1/3 of the children are obese, and very 1/9 of the common man are obese. Then again, the metabolic disorders, a lot of conditions are arising out of this. Then they expose the foolishness of the weight gain, losing weight. A lot of persons, important persons are often perished by this irrational things. Nobody can support this. There is no reason nor base. On what base? Always it depends upon a multifactorial because of the hereditary is there, the diet is there, his lifestyle is there, his environment is there, occupation, almost a lot of associate factors are there. So by considering all these factors, one should give a suggestion to a person than blindly going to reduce your ego and reduce your weight. That's good. Nice suggestion. Congratulations, doctor. Thank you.
Is there anyone want to participate in the discussion? Please raise your hand so that we can allow you to speak to Dr. Najeeb. You can ask your question as well as you can add something more to this session. That's the beauty of our day.
Often the six pack leading to a 6 feet box ending. That's what happening. Untimely
Yes,
death often happens.
True. There are many occasions, many examples in this, like, people who end up having a lot of complication and, even died out of, drastic measures. There are some movements and cult called anorexia cult in Western world. They promote extreme anorexia, extreme thinning of their body, ended up having a lot of disaster, diseases, and even cases of death. Of course, doctor. Thank you so much.
Dr. Mas from Malaysia, do you want to speak to Dr. Najeeb? And you have any question? Please unmute yourself, Dr. Mas. Yes, please unmute.
Sorry, Dr. Dinesh, I just joined in, so I have not listened to many of what has been said. But yeah, I mean, I was just listening towards the end of the topic. Anyway, it was a very interesting, very important for us to measure so that we become healthier and not become obese. Yeah, that's all. Thank you.
Thank you.
Thank you, Doctor. Another young man, Dr. Ram Paresh sir, is there. It was because he is keeping his body fit all times, so always watching the session and continuously for 2 hours, and sometimes he is always there in our English Malayalam session also. So you can
Thank you, Dr. Ganesh ji, and Namaskar, Dr. Manoj ji, and good evening, everyone, and congratulations, Dr. NAJEEB Ahmed sir.
Thank you so much.
Very nice presentation, excellent session, holistic approach of the body composition, being.
Thank you so much.
Mentally and physically health. How to mentally or physically health due to diet and other system. well-being मतलब खुशहाली आनंदमय. So very thanks Dr. NAJEEB Ahmed sir.
My pleasure, sir. My pleasure. Thank you so much, sir.
behalf of IFPH
आपको मिलने का
whole
खुद
team.
खुशी है.
Hello, sir.
आपको मिलने का भी बहुत खुश है मैं.
So, behalf of IFPH whole team, very, very thanks again presentation. Thank you.
Thank you, sir. Thank you.
Dr. Najeeb, in Gulf countries, so the people are thick and fat, but they are still healthy, seem to be very healthy. What's your opinion on that?
True. One thing is the people who are using ethnic food, ethnic diet culture in many part of the Gulf country, those who are city dwellers, urban people, everybody have same food. You go to even in Dubai, in Gulf countries, you go to a little urban area, those who are living with traditional food, traditional diet pattern, they are healthier. Even I have been in Saudi Arabia so many years, have seen 90 years old, 85, 90 years old people, Buzurg, they without eyeglasses, they drive, their cars many hours, have opportunity to travel with them. So they are so healthy, they are so active because they are all, but you will see them mostly in rural area than cities. So those who are westernized their lifestyle, they are suffering. Those who are in the city, in the remote area, they are still healthy. Even today, I have seen a lot of people when we go to,
Yes. Yes.
yeah.
Yes, sir. एक
Yes.
कहावत है हिंदी में, नित दिन खाए फल फूल और कंदमूला. नित दिन खाए फल फूल और कंदमूला, तन मन स्वस्थ हो जाए, बन जाए, हो जाए गुलशीला.
Beautiful. Thank you so much. So beautiful. Both cool.
Thank you, sir. It's the time to wind up the session. I invite Dr. Boblin to say his comments as well as Doctor can say a word of thanks to the session also.
Thank you, Dr. Danesh. Today, I'd like to congratulate Dr. NAJEEB Ahammed for sharing a very good subject today about the holistic approach to body composition, well-being. As Heinemann and those famous doctor says that disease is a combination of a complex system. This is not only based on bacteria or viruses, but it is the result of a complex form that intervene with each other that cause the person to be unwell. And I agree with Dr. NAJEEB Ahammed that because of all these factors that he has mentioned about our body fats and body weight and the amount of water we should drink, etc., etc. All these are important to maintain the homeostatic conditions of our body. Just like Dr. Heinemann says, if these factors are not taken into view, it might cause imbalances in the system and it affects the vital force. So when the vital force is disturbed, disease manifests itself. So says Dr. Heinemann, our founder. And to sum out, I'm Bob Lim from Malaysia, and I'd like to thank IFPH for organizing this continuous webinar. And today is the 1517 of 1507 to show our appreciation and thanks to Dr. NAJEEB Ahammed for sharing his knowledge today, and he has done a very good job by giving so much details to us. Thank you very much once again, and we hope to hear from you in the near future. Over to you, Dr. Danish.
Yes,
Thank you, Doctor.
thank you, Dr. Boblim. And definitely we can have another session from Dr. Najeeb in the second week of November, as per Dr. Najeeb's convenience, because this subject is an interesting one, not only an interesting one, very important one. And he is a person who can do it in a beautiful way. Congratulations to Dr. Najeeb once again, as well as those who attended the session also. Thank you all for joining the session. Tomorrow we will have a session from Dr. Amrita Manoharan, and she will be talking about polysysthemia and homeopathy. So hope all of you will be there with us tomorrow at the same time. Good night.